Hi August.
Hi.
My name is Dr. Kewas, and if you wouldn't mind, today I would like to do a full body examination on you. So it would involve me looking at your skin and at the symmetry of your body, if there is anything that could be possibly dangerous or harmful in the future, or even now. Okay, so do you struggle with any pain, with any medical problems at the moment?
At the moment, I've got very tight muscles on my neck, and it's causing some headaches and pain at the back of my head.
Okay, perfect. Oh, not perfect, but I'm glad to know. Okay. So, first off, I'm just going to look at your skin. I'm going to look for any discoloration, for any redness, lesions, and bumps. Okay, also on your shoulders. That seems fine. Going to look at your hands. Going to take this and look at it from the outside. Okay. Now from the inner side. Okay, now at your hands. Perfect. Great. Now on the other hand. Okay. Now from the inner side. I can see that you have a little tattoo here and on your fingers. There are some marks on your arm, but I think it is just from sitting on some kind of fabric that had a pattern. Okay. Otherwise, it seems that your neck is symmetrical. I'm going to look at you from the side. If you possibly have barrel chest, and you don't. Perfect. So, now what we are going to do, I'm going to look into your hair. I'm going to look at the scalp and at the hair pattern. So, I'm looking if there is anything abnormal. Okay, I'm also looking at the hair loss. Do you struggle with hair loss lately?
No.
Okay.
No, not that I'm aware of.
Okay. It's actually normal to lose hair, but to a certain extent, of course. Okay, so this seems fine. The hair pattern seems fine as well. Great. I'm just going to palpate now. So yeah, I think that's good. There's nothing abnormal. Okay, so I'm going to ask you, what is your approximate height?
5 feet 4 inches.
Yeah.
Somewhere between 5'4" and 5'5".
Yeah. Okay. So now I'm just going to check your pulse. I'm first going to try it on your neck. First on this side and then on this side. First I will ask you to inhale and then exhale. And when you exhale, I want you to hold the breath, and I will just listen to it. I'm going to take my stethoscope. This. So you can take a breath in, out, and hold the breath for a second. Okay, perfect. Now on the other side. Take a breath in, and hold. Perfect. Thank you. Now what I'm going to do is I'm going to take your wrist like this, and I'm just going to check the pulse. Okay, that's great. Perfect. Thank you. Okay, now I'm just going to touch you and try your temperature and texture. Okay, so it seems that your blood flow is really good because the temperature is same overall. Okay, perfect. And we will try if you're hydrated enough. Do you drink enough water?
Probably not.
We will try, and it pulls back nicely. How much water do you drink, or how many glasses a day or liters?
Minimum of 3.
Yeah.
So I tend to have one at breakfast, one at lunch, and then 1 or 2 at dinner time.
Yeah.
But sometimes more, sometimes less.
Okay. So definitely you should look into that. It can actually also help you with the headaches. Okay. But it can also be because just your muscles are strained here. Okay, so I'm just going to now look at your lymph nodes. Okay, now on the back side of the neck. Okay. Perfect. I can definitely feel that you have tight muscle here as well. Okay. It could be probably good to stretch it sometimes, or go to a massage. It could help a lot just to release the tension, and it could like really ease the pain of your head. Also, if you're having it a lot, there might be a problem. Maybe your sleeping position or anything like that. Maybe you're sleeping too much on your side, or yeah, and or carrying a heavy loads. So maybe just look into these things.
Okay.
Also, sitting a lot might be a problem as well, because just your shoulders are going a little too forward. So it's better to not really to retract them like that, but just maybe pull them down, like if you wanted to go into your lats. Yeah. So like this. Okay. So now I'm going to palpate your frontal sinuses. If there is any pain, let me know. Okay. Now the maxillary sinuses. Okay. And now the DMJ. So I will ask you to open your jaw and move it from side to side. Perfect. You can close it and clench your teeth. Perfect. That's great. You can release it. That's awesome. I'm also going to palpate your supraclavicular lymph nodes, which are here. I'm just going to look for it is actually funny that you can even get a tumor recognized in your stomach here on your supraclavicular nodes. It's not really funny, but you know, yeah, good. Okay, that's it. Now we are going to try some cranial nerves. I'm going to make you some funny faces. So first of all, I will ask you to really open your eyes as you are surprised. Perfect. Now smile on me like this. Perfect. Now I'll ask you to puff your cheeks. Yeah, and stick out your tongue real quick. Perfect. Okay, that's pretty much it. So I'm going to look at your eyes. So I'm just going to shine a light into it, and I will watch the pupillary reflection. First I will try direct and then consensual. Okay, so I will just put my perfect. Now here. Okay, now the light reflection from the temporal side. Yes, and it is intact bilaterally. Perfect. So I'm just going to get really close to you, and I will look at your eye really directly up close, and I will look for any kind of troubles. I'll be visualizing the vessels in the eye and so on. Sorry, it's okay. So, okay, I'm visualizing the optic, and it's pretty clear and nice. Your sclera is really white. Perfect. I'm also going to look if your conjunctiva is moist, so I'm just going to pull your eyes down a little, just a little, and it's nice and pink and moist. Perfect. Great. Let me take we are going to go to hearing test now. So I'm going to take my tuning fork. I'm going to ring it, place it on the central part of your forehead, and you will tell me where you feel the distribution. Is it the same on both sides? Yeah, perfect. Great. Now what I'm going to do is that I'm actually going to place it behind your ear, approximately here, okay? And you will tell me when you stop hearing the sound. Okay. We're going to try the conduction of sound through bone.
No.
Okay, can you hear it now?
No.
No? Okay. Now let me put it here. Tell me if you hear it. Mm-hmm. Tell me when it stops.
No.
Can you hear it now?
Yeah.
Okay. Perfect. So it was your right ear. Where was the problem? Great. So what I'm going to do now, I'm going to whisper some words into your ears, and you will just repeat what I said. August.
August.
Yellow.
Yellow.
Okay. That's great. So the hearing feels fine. I'm just going to look into your right ear now to see if there is any problem. I'm going to be stretching your ear up like this so that I can really visualize the tunnel, okay? Okay. That seems fine. Your ear doesn't seem clogged at all. Perfect. Yeah, it's pretty clear. I could see the reflection Perfect. So now I'm going to have you try some range of movements. We are going to do first with your head, and then we are going to switch to the upper extremity. So I'm going to ask you to move your head to the side. Now to the other one. Okay, now tuck your chin. And to the other direction. Okay, and now like this. And move your head to the shoulder. And to the other side. Yeah, that seems pretty normal. Was it hurtful?
Yeah, here.
Here at the side. Okay. Do you work physically? No. Okay.
I think that's the problem. I don't do enough exercise.
Oh, that might be definitely a problem. Yeah, as well.
I used to do a lot, and now I suddenly stopped.
Yeah.
Like I used to do a lot, like weights and stuff.
Yeah.
And now I do nothing.
Yeah, I know this. I had the same problem as you. But if you just really try to, it doesn't really have to be like lifting weights. It can also be just yoga or some kind of stretching, you know, and something like to give you the support in muscles. Yeah, so it will be really great to start at least with something that is not so heavy and hard. Yeah. Okay. Just going to write it down. Now, what we are going to do is the range of movements with your hands. I'm going to ask you to have them like this. And now if you can do this. And to the other side. Okay, perfect. The other side. And tell me if you feel any pain in the area as before.
This is a little bit tight.
Okay.
That's fine forwards. It's just when I go slightly here.
Yeah, okay. So right there. Good. I will try a resistance test. I will have you have your hands like this again. I will press onto them and you just resist me. Okay, now to the other side. Great, perfect. You can have your hands like this. We'll do the same again. I'm going to press on you and you will try to resist me. Perfect. Great. Now with your hands like this, again, I'm going to be pressing and you will try to keep them as wide as possible. Perfect. Now I will do the same. You will have your hands like this, completely relaxed. And I'm just going to press onto it and you will resist me. Now from the other side. Perfect. Now here and here. Perfect. That's it. And I think that we can actually go to the pulmonary inspection, which means that I'm going to be listening to your lungs. I'm going to be palpating and percussing your back. So if I may ask you to turn around and take off your shirt. Okay, so since you said that your back is hurting, I'm going to be palpating these areas, and you will tell me if there is any pain when I press to the skin. Do you feel any pain?
No.
Okay. Now on the other side.
A little bit, just there.
A little bit, right? I can actually feel that it's really tight, especially this area here, right? Yeah. Okay. So I'm just going to press some points here. And I will try to make the muscles a little more relaxed. Just to loosen a little bit. going to also palpate your neck, right here, the spine. Okay. Do you struggle with pain in your lumbar spine area?
No.
Okay. Okay, great. So what I'm going to do now is that I'm going to take a listen. I'm going to be osculating your lungs, so I'm going to ask you to take a deep breath in and out. It doesn't have to be like to the fullest, but a little deeper than normal. Okay, so we can start now. Okay, exhale. Now here. Here as well. Okay. I do not hear anything unusual. There is no wheezing. You do not have any troubles with breathing rate. Okay. So, what I'm going to do, I'm going to separate your hair to the sides, and I'm going to be percussing. It should not be hurtful. I will just try to find out if there is a lot of blood under your skin, in your lungs, and so on. There is different sound when there is a lot of blood and where there is less. So great. That's good. Okay. Now I will ask you to take your shirt on. Okay, so now I'm just going to be palpating your thyroid, and I'm going to be moving it from side to side. It might be a little bit uncomfortable, okay? So if you mind me touching it, just say so. So, just going to be palpating it. Can you swallow for me? Okay, now I'm going to be moving it from side to side. That's great. I'm just going to be palpating your nose and the cartilage here, and I will be moving it from side to side, see if it's movable, and it is perfect. Now what I'm going to do is that I'm going to look at your hands, and I'm going to be pressing onto the PIP and DIP joints, and you just tell me if there is any kind of pain, okay? And I do not have any brush on me at this moment. I just want to test if your feeling here is alright. Okay, if the nerves endings in your hands work as they should. So I'm just going to use my finger, if you don't mind, and I will just trace your fingers like so, okay? So I'll first take this hand. Tell me if there is any spot where you do not feel a thing. You should be able to feel it. On each and every part of your hands. Lastly, the thumb. Okay. Was there any place where you did not feel a thing?
No.
Okay. In this case, we are done with the examination. You are absolutely healthy. I would look more into the stretching. First, I would go to a massage, okay, to really release it. Then I would advise you to start stretching it. Maybe it would be good to find a physiotherapist to really help you to give you the right stretch exercises. However, if you're trying to look on YouTube, I bet that you will find there's someone who will help with this particular area as well. Okay. And once this is done, you can actually start really to exercise again, and it should get better. Okay. Okay. And also look into your sleeping position. It's really crucial to have a good cushion. Okay. 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 Perfect. Thank you very much.
Thank you.
Bye.